Hello, everyone, and welcome. Thank you for joining today's webinar, Supporting Older Individuals Through Difficulties and Change, presented by Home Instead and hosted by the American Society on Aging. Before we begin, here are a few important notes. You may have noticed a recent change on our webinar pages regarding CE availability. To align with evolving guidance from regulatory boards, we refine how CE information is presented. Please note that not all webinars offer all types of continuing education credit. Each webinar page will list the specific CE types available for that session. We encourage you to review the CE details carefully. If your specific accreditation board isn't listed, we recommend checking with them directly to confirm whether one of the available CE types will be accepted. You can apply for your certificate right after today's webinar by clicking on the tab above the presentation screen. Select your certificate type or board, and if you don't have a license number, just enter NA. For more information, click the How to Claim Credit tab. Throughout the webinar, you'll see periodic engagement checkpoints. Please disable your pop-up blocker and respond when prompted. Instructions for disabling pop-ups can be found under the Reminders tab. If you experience any technical issues, please try refreshing your browser. If the problem continues, click the Help tab for assistance. You'll find today's presentation slides in the Materials tab. A recording will also be available in your classroom within 48 hours. And finally, we welcome your questions. Just use the Q&A tab and we'll address as many as we can at the end of today's programming. Now let's meet today's presenters. Dr. Lakeland Eichenberger is a gerontologist and caregiving advocate with Home Instead, the world's largest home care provider. With a PhD in gerontology, Lakeland has worked both directly with older adults and on a national scale to educate families, professionals, and communities about aging and caregiving. And joining Lakeland today is Therese Cesar, president and owner of Home Instead, Northeast Ohio. Therese brings decades of experience in nursing, healthcare administration, and private duty home care. In 2001, she founded Quell Care and began operating as Home Instead Senior Care to provide compassionate support to older adults. She is also co-author of the book Perspectives and a Respected Leader in Senior Care. Thank you both for being here. Lakeland, I'll let you take it away.
Thank you so much, Victoria. Hi, everyone. Thank you for joining us today. I am really excited to dive into this conversation with Therese and is so grateful she is joining me on this topic. We know that change, whether expected or sudden, can be one of the most difficult parts of aging. Older adults often face big transitions like health diagnosis, retirement, moving, or loss. And these moments can really bring a lot of uncertainty and fear, even if they really are necessary transitions or changes. So in today's webinar, we're going to talk about how we can support older adults through these changes and do so with empathy. We'll provide some practical tools and help with some of that kind of shared collaboration. And so whether you're a caregiving professional or if you care deeply about aging, I hope you'll feel empowered and informed leaving this webinar and be ready to help guide others through some of these life turning points. And I know that many of us will be caregivers at some point for an aging loved one. So if you haven't already faced some of these challenges personally, I hope you also can find some insight that will help you on a personal level as well. So let's take a look at the objectives for today. So we're going to review common difficulties and transitions that are experienced by older adults. And we'll talk about some of the factors that influence an older adult's ability to adapt to the change. We'll explore a couple different models and frameworks to support the discussion to help through these transitions, and then discover some communication strategies when we're met with difficulties or resistance, which I know we all have faced from time to time. So again, so glad that you're here to join us. And I'm actually going to pass it over to Therese to get us started on the common difficulties and transitions that we often see the older adult population facing.
Thank you, Lakeland. Transitions can be especially difficult for our older adults, whether if it's a hospital discharge, a new diagnosis, or a shift in their care plan. As healthcare professionals, understanding the emotional and cognitive challenges older adults face during times of change is critical to delivering compassionate, person-centered care. Some of the common difficulties and transitions of the older adult are health changes and diagnosis, retirement and loss of professional identity. Usually we think that this would be maybe a joyous time, but this can also come with challenges adjusting. Moving or relocating to new supportive environments, bereavement, loss of family, friends, community, accepting of outside care and support, mobility limitations, shift and change in care plans, cognitive changes, loss of independence and autonomy, chronic conditions and medication management, and hospital discharge. And certainly there's just so many more difficulties and transitions the older adult faces that we have not even mentioned. Also, some of these difficulties could even overlap, such as limited mobility and loss of independence. Another example is chronic conditions and medication management and hospitalization will also coexist together as difficulties for the older adult. Now that we know about the common transitions, let's talk about why they can be so difficult. So why is change difficult for the older adult? Well, cognitive changes, normal aging can involve slower information processing, diminished working memory, and decreased cognitive flexibility. This can impair adaptation to change, new situations, and new routines and environments. The emotional load. Many older adults are already navigating cumulative losses, bereavement, chronic illness, or social isolation, making additional changes even more emotionally taxing. Familiarity and routine provide for many older adults a deep sense of security. Changes, particularly those tied to health or independence, can cause significant stress, leading to anxiety, resistance, or even emotional withdrawal. Here's a few more reasons. Fear of institutionalization. Surveys show that 89% of seniors prefer to age in place. Any shift that is perceived as a step towards dependency or relocation may be met with resistance. Health risks. Emotional distress during transitions is associated with poor recovery trajectories, including increased risk for depression, non-adherence to treatment, and even rehospitalization. A study by Wiles found that maintaining independence and aging in place are essential to many older adults' identity and emotional well-being. Any change that diminishes this perceived autonomy can trigger resistance and duress. So now that we know why change is difficult, let's start focusing on preparing for that adaptation. So when we talk about how older adults adapt to change, whether it's a health diagnosis, a loss, or a shift in living situation, several key factors come into play. First, resilience and coping history shape how someone navigates differently. Those who've developed healthy coping mechanisms over a lifetime tend to handle transitions with more confidence and flexibility. Next, emotional support from loved ones is essential. Isolation can make any change harder, while having people who listen, validate, and encourage can significantly ease that adjustment process. Cognitive and mental health status also play a critical role. For someone with dementia or untreated depression, even small changes can feel overwhelming or threatening. Motivation and willingness, essentially the older adult's openness to adapt, can be a make or break factor. If someone is resistant or afraid, adaptation is much slower, even if the supports are in place. Their personal beliefs about independence also matter. For example, someone who equates help with weakness may reject support that could improve their quality of life. And finally, knowledge and skills. Whether it's learning to use a walker properly, manage medications, or navigate an entirely new environment, these knowledge and skills can directly influence how smooth an older adult will transition. Understanding these factors help us approach each older adult as an individual, offering a tailored and supported environment that respects their strengths, needs, and values. So let's talk and focus a little bit more on the barriers, and let's bring Lakeland back in to talk a little bit more with me about those.
Thanks, Teresa, for walking us through those factors. Gosh, this is a really tough conversation. And I mentioned that at the start of the webinar. And as we prepare for these conversations, understanding those factors, understanding these potential barriers can be really helpful. And as you and I were preparing for the webinar, we're talking about how they kind of fall in these three buckets of potential barriers: the clinical, emotional, and psychological, and the kind of social other that we kind of dumped anything that didn't fit in those first two categories. But from a clinical perspective, Therese, since you are an RN, would love to hear from you. Like, what are those clinical barriers that could potentially arise when an older adult is faced with change or transition?
Yeah, thanks, Lakeland. Absolutely. When supporting the older adult through change, we need to recognize what these barriers are. So clinically, chronic illnesses and cognitive decline can limit not only an older adult's ability to adapt, but also their energy and focus to even try. Complex treatment plans can be confusing, especially without clear explanations. Some individuals may not even recognize symptoms that indicate a need for change, like increased fatigue, pain, or confusion, leading to delayed responses. On the emotional or psychological side, fear is a powerful barrier. Fear of losing independence, fear of the unknown, or just the fear of burdening others. Worry, mistrust in the healthcare system, unresolved grief, and depression can make it even harder for the older adult to take steps forwards. These emotions can cause them to shut down or resist necessary transitions. And then that bucket of others that we talked about, we kind of threw everything in. Socially, isolation is a huge risk factor. Without people to talk to, lean in, change can feel just totally overwhelming. There's also a stigma around aging, illness, or even asking for help, which can prevent individuals from seeking the support they need. As roles shift, for example, from caregiver to care receiver, it can lead to identity struggles. And finally, financial limitations. That weakness support systems can drastically reduce available limitations, further compounding that resistance to change.
Thanks.
Really difficult.
Yeah, thanks, Therese, for diving into those a little bit more. It really can be hard to see an older adult kind of come up against some of these barriers. But it's important, for us as professionals to really advocate for them, help them overcome these barriers, and really approach the whole conversation with a lot of empathy. And we know that, it's not a one size fits all approach. And so it really does need to be tailored to the older adult and really kind of meet them where they're at. Would you say, Therese?
Absolutely. And then I think you and I, as we went through, we loved this quote. And that change and adaptation is a process. It's not a single event. So we just need to start, like you said, meeting them where they're at. Next, Lakeland, can you walk us through the stages of change and the tools that we can use? This is just such an important part of this whole change process, and really goes into detail about what we need to do.
Absolutely. Well, and the stages of change can really kind of help us understand where an older adult is at in the whole change process. So yes, I'm going to walk us next through the stages of change. And this is also known as the trans-theoretical model. Stages of change, I, as kind of with my academic background, I love a good model. And this theory, this model can help us, again, understand where an older adult is at in that change process. And then we can kind of, again, meet them where they're at and help walk them to maybe the next stage of change. So the first stage is that pre-contemplation. So in this stage, sometimes there's a lack of awareness. They might not recognize that change is needed. They might not understand that their current situation is unsustainable. They might be resistant to suggestions in this stage. So when we're walking with them through change, our role is not to push at this point. It's to start to gently plant the seeds, offering information, expressing concern, and building trust with that individual. So then the next stage is contemplation. They start thinking about the change. So here, as they begin to acknowledge it, they might start to express some fears or uncertainties. And really, this is a time when we can help validate their feelings and listen without judgment, which we're going to talk a lot more about listening here in just a bit, and then kind of help them explore the pros and cons of the change together. And then in the preparation phase, they've finally made up their mind to take action. They want to start maybe planning towards the change, and they may be asking you for a lot of questions. They might be seeking out resources, and this is a great time to provide that encouragement, those practical steps, and reassurance that you're not in this change alone. You have the support around you. And then they move to that action stage. They've started to make the change. Change is happening. Woohoo! So the person might be trying out new behaviors or routines, or maybe they're trying a new care option. And at this point, we really want to be encouraging, applaud their efforts, and offer additional support to help them maintain consistency. And I think it's also important at this stage to recognize, change can be bumpy, but understanding how this change is impacting them can allow us to be encouraging and show them where it's making a difference. And then it moves into that final kind of phase of maintenance. They have a new routine. It's become part of daily life. So it's important to remind them, there could be setbacks, and that's normal. Not to get discouraged, but continue to support, provide positive reinforcement, and continue to check in to make sure that they maintain that important progress over time. And I think it's also important to acknowledge that this change model, it's not always linear. Sometimes people can move back and forth between the various stages, and that is normal. So again, our goal is to walk alongside them with patience and empathy, no matter where they're at on the journey. And sometimes not sometimes, all the time, it is helpful to approach this from kind of a point of motivation. And so understanding where they're at allows us to provide that right amount of support. And so at each of the stages, I'm going to kind of talk through how we can continue to motivate the individual through these stages. So in that first kind of pre-contemplation, awareness raising stage, we don't want to rush them. Again, we want to plant those seeds. We can share stories of maybe how other people have been successful in implementing the changes. We can ask thoughtful questions, which I'm going to give you a lot of examples coming up. We can create a safe space for them to reflect. And we can share our observations with kindness. And we want to use non-threatening language. Ask questions like, have you noticed? Or what have you been thinking about, regarding a certain topic? How have you been feeling about that lately? In the contemplation phase stage, we can help them explore those pros and cons, have that open dialogue, help them weigh the emotional and practical impact of, changing versus staying the same. At this point, we don't want to sell a solution yet, but we want to ask more open-ended questions. What might be easier if you made this change? Or how, what about this change is making you hesitant or resistant? In the preparation phase, this is where we can help them build confidence and create that plan. So you really create kind of a roadmap for change, offer tools, resources. You can even help with some of the practical things like making appointments if they're needed. But really, it's important from a motivational perspective to express belief in their ability to succeed, affirm their readiness, and offer to help break the plan up into smaller bite-sized steps that are more manageable if that's needed. In the action stage, we want to then support those small steps. So acknowledge every step forward, keep expectations realistic, celebrate the progress, even if it seems minor. And this positive reinforcement will then hopefully help build momentum. Again, we can remind them, setbacks are normal. The goal really is progress, not perfection. That's a really important phrase I've had to say to myself in many situations in life: progress over perfection. And then finally, in that maintenance stage, we can help motivate, reinforce those ongoing changes, acknowledge how far they've come and how it has improved their life, recognize their efforts, and offer strategies here to help them stay consistent. Like maybe they need reminders set on their smartphone for medication reminders, or how can they build this into their daily routine? And so this motivation, really a tool to help you with this, is called motivational interviewing. And we know that in so many situations in life, communication plays a huge role, and our communication style matters. So we want to talk with older adults in a way that helps them feel supported and empowered. So motivational interviewing gives us the framework to have these conversations with that empathy and also with intention. So part of this motivation interviewing style is emphasizing collaboration, not persuasion. So instead of convincing someone to change, we want to join with them in a collaborative conversation. We're not there to fix, we're there to listen, reflect, and walk beside them. We also want to build autonomy and confidence. Everyone deserves to feel in control of their own decisions, especially older adults that might be experiencing a lot of loss of their independence and autonomy. They feel like a lot has been taken away from them. So, helping them feel in control can affirm, their strengths, their values, and celebrate their ability to make choices. And then we also want to foster trust through that empathetic dialogue. So we want to actively listen. We want to have that open body language, use a kind tone to help build trust for these really meaningful conversations. And, even if we don't agree, we need to, show respect in our approach to the conversation. And really, again, motivational interviewing is about partnership. It's not about doing something to someone. It's really about working with them to support them through the change they want to make and at their pace. So I have another kind of model that you can use to help you in your daily interactions. It's the OARS framework for conversations. It's a communication style that's really rooted in that empathy and collaboration. And I love a good acronym. It's simple, easy to remember. And so it stands for open-ended questions, affirmations, reflective listening, and summarizing. And we're going to go through each of these individually now. So open-ended questions, these are powerful because they encourage a real conversation. They're not just a yes or no. If you've ever asked someone a yes or no question, you know how quickly that can shut down a conversation. So open-ended questions really invite the older adult to reflect, share, and express what they really think. And these kinds of questions, they show that we value their voice and are interested in their perspective. Again, that goes back to, showing them dignity and reinforcing that we want to hear right from you what's important to you. And it's not just about asking the questions, it's about listening to the answer that follows. We're going to talk a lot more about listening, but really just having a genuine curiosity, being willing to slow down and to hear the full story. Sometimes we want to be quick to jump in, offer advice, but try to resist the urge. Instead, give them the space to lead the way. So some examples that you could ask to really implement these open-ended questions and open the door for deeper conversation and understanding. You could say, how could I help you with fill in the blank? This really shows that you're there to support. You're not going to take over. You could also ask, help me understand blank. That's a really non-judgmental way to explore their resistance or their hesitation. You could also ask, how would you like things to be different? And this centers around their hopes and their goals, not just the problem itself, because we all have hopes, dreams, and goals, no matter the age. And so it takes it away from just the problem and focuses on those. Another could be, what do you think you might lose if you had to give up blank? And this really acknowledges the emotional weight of change, and it really invites an honest conversation, some honest reflection. And then, what have you tried before? This helps build on their strengths, their past efforts. One of the reasons I love working with the older adult population is they have all lived a full life, a robust life. They have had so many life experiences, so many wins, and so many losses or struggles, and they've overcome them. They have learned from them. So I think we can draw on those experiences as we help them realize, I've overcome something hard before in my past, and so leveraging that strength can be helpful. And again, these invite opportunity for reflection. It's not just about pushing a solution, but it's helping them find their reason for change in their own words. And if open-ended questions don't come naturally to you, really just adopt the mindset of staying curious and shift from giving advice to just wanting to learn more. And that might help you kind of with that transition. And as we continue, I before we go to the next part of this acronym, I did want to look at some potential communication roadblocks that can easily creep into these conversations. And often, we're not saying these things with ill intent, but sometimes they happen to come out and they can really shut down the conversation. Sometimes these roadblocks come from a place of wanting to help or protect or fix, but they can make the person feel unheard, judged, and powerless. So there's quite a few of them, so I'll kind of run through them quickly. But again, don't beat yourself up if you find that you have used these, or even if you use them in the future. I think it's just important to become more mindful and aware of these potential roadblocks. And if you use one, it's not the end of the world. But you can maybe pause in the moment and then ask a more open-ended question after the fact. So these roadblocks can look like directing or commanding, telling someone you have to do X, Y, or Z. This can feel controlling and diminish their sense of autonomy. We definitely don't want to threaten or warn, by saying, well, if you don't do this, then X, Y, Z. It can create fear or defensiveness rather than the motivation that we're really seeking. Giving advice doesn't always land well. It might seem helpful, but could come off as dismissive. So things like, well, let me suggest. So sometimes that can not lead to the desired outcome. We also want to avoid lecturing and arguing. You want to avoid this because it can put somebody on the defense. It can put them into this debate mode, and then it doesn't become as much of a dialogue. Moralizing or preaching, saying you ought to, sometimes that can feel condescending or guilt-inducing. Judging and criticizing, saying you're not thinking clearly, it can risk the trust that you have built with that individual, and it could also be a hit to their dignity. Approving and praising, while sometimes it can be done with the best intentions, can sometimes backfire by making it about us instead of them, by saying things like, oh, I totally agree with you. Ridiculing and shaming can be counterproductive. It can really generalize and offend an individual. Reassuring and sympathizing, saying things like, well, look on the bright side. It might silence their real feelings and prevent validation of what they're going through. Probing and questioning, saying, why did you do that? That can sound accusatory and place somebody on the defense. Analyzing, what you're doing is blank. That can feel like the person's being put under a microscope. And then sometimes distracting or changing the subject is not always effective because you really miss the opportunity to connect on what really matters. So, saying, let's talk about something else. You're just kind of passing the buck down the road and not getting to the heart of the matter. So again, I have used these communication roadblocks, but I think it's important for us to be reminded of them regularly so we can try to minimize it as much as possible. And again, if you use them, don't worry, we're all human. They do slip out from time to time, but instead try to use those open-ended questions. And then also use affirmations, which is the next part of the ORS framework. Affirmations are really sincere statements that highlight a person's strengths, efforts, and values. And they're not just compliments, rather they build confidence and trust. And so in the context of caregiving or supporting older adults, it can help the older adult feel seen, valued, and capable. Change can be really overwhelming. So when we acknowledge the steps that someone is taking, no matter how small they are, it reinforces their ability to keep going. And affirmations can be especially helpful if somebody is feeling unsure or discouraged or stuck. And it can help shift the focus from the problems to the possibilities. But an affirmation is most effective when it is genuine. The person should really feel like you mean it. I'm sure you've received a compliment that hasn't seemed really sincere. So people can sense it. So, you want to be specific and relevant to the moment and make sure your affirmations, fit within the context. So some examples of how you could use this in action. You could say things like, I appreciate your willingness to meet with me today. You're clearly a very resourceful person. It highlights their strengths. or you handled yourself really well in that situation. It validates their resilience, their composure. If I were in your shoes, I don't know if I could have managed that nearly as well. That expresses empathy and admiration. And then, I've enjoyed talking with you today. It leaves the conversation positive and very relational. And affirmations for some may feel awkward at first if you're not used to saying them, but if they come from a place of sincerity, they really can transform the conversation and the relationship. Okay, so next on to the R, and I told you I'd talk a lot more about this, and listening is so important, especially reflective listening. And it's more than just about hearing, it's about deeply understanding. So it really helps confirm what the person's trying to communicate and prevents miscommunication. So when somebody feels truly heard, they're more likely to open up, trust, engage, and have a meaningful dialogue with you. So the goal is to confirm understanding, and not just the words said, but really the emotions and the intentions behind them. So it's also about honoring the older adult's inner wisdom. I mentioned earlier, people have overcome so much in their lives, and if we're able to listen, respect that inner wisdom, that can go a long way. And in this kind of listening mode, we're not correcting or directing, we're really echoing and validating. So there are 3 levels of reflective listening. The first is repeating or rephrasing. So this involves echoing key words or phrases that the speaker uses in their own language. So when you are doing this, when you're repeating or rephrasing, you're showing that, okay, I'm tuned in, I'm listening, I hear you. So here's an example. The older adult might say, I don't know why everyone is pushing me to do more. So you as the listener could say, you're not sure why, So as the listener, you would say, you're not sure why people are pressuring you. Again, that shows you are listening. They're saying, I don't know why everyone's pushing me to do more. And you're saying, oh, okay, so I'm hearing you. You're not sure why people are pressuring you into this. Again, that can be really validating to hear that. Next is paraphrasing, and it takes it a step further, so you can restate what the person has said in your own words, inferring, their intended meaning. So as an example, they might say, I wish I had more energy to get out and enjoy life. So as you listen to this, you might paraphrase and say, well, it sounds like you miss feeling energized and connected to the things you enjoy. Did I hear that correctly? So paraphrasing can be helpful. And then the final level of reflective listening is the reflection of feeling. So this is the deepest level. It focuses on the emotional content, naming the feeling that they might be expressing, even if it's unspoken. So sometimes, the tone that we say things can tell us as much as what's actually being said. So for an example, if the older adult says in an angry voice, everyone keeps telling me what to do. As a listener, you could say, you sound really frustrated with how others are handling this. So when you kind of name the emotion, you sound frustrated. Is that true? Tell me more about that. Can open up just the opportunity for them to share more about their frustration. And sometimes when we can name a feeling, that really helps us process it. So really, we want to practice this reflective listening, and it does take some patience and humility, but it's really one of the most meaningful ways we can show an older adult that, I hear you, I value what you're saying, and I care about how you feel. So, practicing this reflective listening can really go a long way in, again, creating that relationship, that collaboration between you and the older adult. And then the final part of the ORS framework is summarizing. This really brings everything together. It helps clarify what's been shared. It's confirming we're listening. And then it gently guides the conversations towards change, and doing so at a pace that feels right for the person. And you can use these summaries at natural points, like wrapping up the conversation or shifting from the exploring to kind of planning phase. It's also helpful when someone has expressed some mixed thoughts or when you want to highlight, what seems to be mattering most to them. And so there's a simple kind of structure that I'm going to walk you through on kind of the structure of a summary. So you can start with a statement of intent, and this lets the person know you're going to summarize. It kind of sets the tone for collaboration, not correction. So examples of this are, let me see if I understand. And then you can, summarize what you feel like you're understanding from the conversation. Or you can also, maybe even within the same conversation, say, tell me if I've missed anything. This is what I'm hearing. Again, that helps kind of cue to the person you're talking with that I'm trying to summarize what I'm hearing. And then highlight change talk. This is the heart of the summary. You listened and reflect back. So you want to recognize the problem, what they've expressed as a concern. So for example, it could be, I've fallen a lot recently. So you could let them know, I hear that you are saying that you've fallen a lot recently. You can highlight the concern that they're worried that something might happen. I understand that you feel like something bad might happen if you don't get extra support. Also reflect back their intent to change, what they're considering doing differently. I hear that you're open to some potential support. And then optimism. These are the strengths and hopes that they've expressed. So you could say, you had shared with me you've been through some hard times before, and so with some extra support, it sounds like this is something that you can address. And then I think one important thing to do is to acknowledge any mixed feelings if they're present. It's okay to have two opposing truths at the same time. And sometimes people often feel pulled in two directions. And so if you can reflect, any of this that there might be feeling, it really shows your empathy for them. So you would say something like, on one hand, I know you value your independence, and on the other hand, you see the need for support. So I know that can be hard to have those feelings at the same time. You can also add any other relevant information that could be needed. So maybe it's clinical input or observations from others. But again, you always want to keep the focus on the individual's experience. We also want to try to be concise. I know that this webinar, I'm walking through a lot of information, but we don't want to overwhelm them. So we want to try to stick to the most meaningful elements, try to be as concise as possible. And then end with an invitation, invite them to correct or add to what you have shared, asking, did I miss anything or anything you would add or change? And then open up the door to what's next. Their response might lead to the planning, reflection, or those small steps towards change. So you could ask, where do you want to go from here? What feels like the next step? And so again, this ORS framework can help you start to open up the door for conversation, get those open-ended questions going. And Therese, I'll pause for a moment since I just talked a lot and get your reflection on some of these frameworks and see if you have anything else to add.
Lakeland, I really, really appreciate you taking so much time to look in detail at the framework of the ORS conversation. It's a really, really important reminder about being present with our patients or our clients and taking the extra time to help build that positive and trusting relationship that will be the necessary foundation for what's to come next. And ironically, when we were going through this, we said, well, there's one slide coming up that's about the change process. And there was, how many preceding conversations in regards to, the conversations and the ORS framework. But that's with it's really exactly what is going to happen. We're going to be spending so much time building that groundwork, that foundation, that relationship in conversation, and to make the change process actually one that can happen. So yeah. For setting that foundation, it was so incredibly important.
Yeah, I think it is interesting that we had one slide on goal setting, but you're right. There's so much. I think there's a lot that goes into the building of trust, the asking them for their thoughts and input, because it is, impacting their life. So then when we hopefully get to the goal setting stage, it maybe is easier or more effective, more successful, because you've spent that time establishing that rapport with them. And then we can work towards this goal setting, and this is where that change actually happens. And when we were thinking about this, we put this quote on there: "You're never too old to have purpose or direction." I think that's so true, and we all want to have meaning and purpose and goals to work towards. So goal setting really can empower us to do, to achieve this change. And so again, we want to work with the older adult together. It should never feel like a to-do list that's handed from somebody else, but more of that partnership, asking those open-ended questions, getting their input. We want also for these goals to be specific, actionable, and reasonable. So instead of a vague goal like being more active, that can feel really overwhelming. Instead, you might say, I want to walk for 10 minutes after breakfast 3 times a week. That feels achievable. It's very actionable, and you can reflect back and say, did I achieve that? Also starting small and building momentum, that can help build confidence. And those small wins can really increase the chances of follow through. So think, one drawer organized, or one phone call made, or one new recipe tried that's low sodium. Small steps can make it less overwhelming. And then track that progress and celebrate it. Maybe you use a simple calendar, and really be that encouraging, motivating voice. You've really followed through on this. That's something to be proud of. And then also put a deadline or timeline to it. It adds a sense of structure and progress. You can also, say something like, let's try this for 2 weeks and then check back in. And that makes it less overwhelming, because it's not something that they have to do in perpetuity. Let's just get to that 2-week goal, check in, see how it's going, and adjust. Because we know life happens, and we might need to be flexible and revisit the goal, and do so with compassion. So you might have to, adjust. If something happened, a setback, say, well, what feels doable now? So this goal setting, hopefully, again, will be easier if you set yourself up for success with some of the motivational frameworks, the ORS conversation framework. But we know that even the best laid plans don't always work. And so sometimes we're still met with resistance or unwillingness. And so, Therese, I would love for you to maybe help us talk through addressing that unwillingness to change.
Yeah, absolutely. Of course, we know even with the best intentions and most meaningful goals, not everyone is ready or even willing to make a change right away. And that's absolutely okay. So we're going to address an older adult's unwillingness to change. And it's often the most emotionally complex and professionally challenging part of our work. And yet, it's also where we have the greatest opportunity truly to make a difference. We start by recognizing that resistance is not defiance, it's human. Older adults may feel their autonomy is slipping away. They may be grieving losses we don't see, loss of purpose, of identity, of a routine. Accepting that resistance is normal helps us approach the situation with much more compassion and a lot less frustration. Second, we must avoid making assumptions. It's easy to misread resistance as stubbornness, when in fact it may be rooted in past trauma, cultural beliefs, or simple confusion. Every individual story is unique, and we must stay curious rather than judgmental. Listening, not lecturing, is a core skill. This builds rapport and shows that we respect their voice. When people feel heard, they are far more likely to open up to new ideas over time. And it's also about planting those small seeds rather than expecting immediate change. Truly, a gentle suggestion today may grow into readiness next week or next month. We're not here to force, we're here to guide. And yes, this takes a lot of patience and a lot of empathy, especially when we're met with that repeated resistance. But if we remain consistent, most of all compassionate and present, we become a steady voice that our older adult can return to when they are ready for change. And finally, and most important, don't give up. Even when progress feels invisible, our presence and persistence matters. Small breakthroughs often begin with trust, and trust, as we know, is built over time. Which brings us to the next essential skill, and that's managing difficult conversations. Whether it's addressing safety concerns, confronting denial, or guiding families through conflict, the way we approach these conversations can shape the entire outcome of a transition. So now let's take a look at some strategies that can help make these conversations more productive and less stressful for everyone involved. When an older adult is unwilling to change, difficult conversations are inevitable, but they don't have to be destructive. In fact, if approached with care, these conversations can be the actual turning point in building trust and opening the door to future change. First, choose the right time and setting. Don't start an important conversation in the middle of chaos or when emotions are already running high. Aim for a quiet, private environment where the person feels safe and respected. And remember, timing does matter. If someone is tired, overwhelmed, or distracted, they're less likely to be receptive. Next, allow space for emotions. These conversations may bring up fear, sadness, anger, or defensiveness, and that's okay. Your role isn't to fix the emotions in this moment, but truly to honor them. A simple, I can see this is upsetting, can go a long way in de-escalating tension and helping the older adult feel validated. And most importantly, keep the conversation open-ending and continue ongoing. We often go into these discussions hoping for a quick resolution, but rarely there is a single conversation that changes everything. Instead, think of it as a series of small steps, building over time. Each interaction is a chance to build trust, clarify concerns, and move the needle forward, maybe just a little bit. When we approach these conversations with respect, patience, and persistence, we create space for meaningful change, even if it unfolds slowly. So next, we are going to go on to some clinical strategies to help support change. As clinicians and care providers, we play a key role in not only recommending change, but supporting our older adults through the emotional and practical journey of making it. These strategies can help us guide that process more effectively and compassionately. First, empathize and normalize feelings. Change also often brings fear, grief, or resistance. When we acknowledge that these reactions are normal, not signs of weakness, we validate the older adult's experience and help them feel less alone in it. Simple statements like, it makes sense that you feel hard, that this feels very hard, can just be incredibly grounding for the older adult. Clear, compassionate communication is also essential. Avoid medical jargon or rushed explanations. Speak plainly, pause often, and invite questions. It's not just about delivering information, it's about creating that space where someone feels heard, respected, and most of all understood. When possible, maintain familiarity and routine. This creates a sense of safety and continuity. Whether it's keeping a favorite mealtime, involving caregivers, or staying in a known environment, small consistencies can provide major emotional support during change. Engage the support network. Friends, families, even care professionals can serve as anchors. Include them in the conversations and care planning. Not only reinforces the message, but creates a circle of support that makes change feel less isolating. And finally, and I know we said it before, let's celebrate those small wins. Progress might be slow, but every positive step, getting out of bed, trying a new routine, attending a social event deserves recognition. Celebrating these moments boosts confidence and reinforces the idea that change is both possible and worthwhile. These clinical strategies are simple, but truly powerful tools that help the older adult feel safe, respected, and supported as they face what often can be overwhelming transitions. So now we are going to move on to our tale of transitions. So we have 3 clinical studies. One is a misstep, one is a success, and we love it that we're ending with even one on a bit of a giggle. So let's start with the unsuccessful approach. We're going to talk about Mr. Thompson's transfer. So Mr. Thompson is an 82-year-old patient recovering from hip surgery. He was abruptly informed that he would be discharged the next morning to a rehabilitation facility. The hospital staff had not discussed the plan in advance, and no family members were available during the decision-making. He did become visibly anxious, stating, "I didn't even get to say goodbye to my nurse here. Where am I even going? Does my family know where to find me?" Once transferred, Mr. Tommen did refuse therapy sessions. He grew withdrawn, and expressed a desire to just go home. His emotional duress ultimately delayed his recovery and extended his stay in the rehab. I think we've all probably seen some situations like this as clinicians, and the takeaway, as we've talked about with the different approaches to navigating change, is Mr. Thompson's experience truly underscores how a lack of communication and patient involvement can lead to fear, mistrust, and in this case, poor outcomes in his clinical care. The next tale of transition is a success. We have Mrs. Alvarez, and in contrast, she is a 79-year-old patient with congestive heart failure. She was sent to transition home with a new medication regimen and daily home health visits. Her care team, including the social worker, scheduled a discharge planning meeting that included her daughter. They explained each step of her care plan using simple language, addressed her concerns, and allowed her to choose her preferred home care health agency. Mrs. Alvarez was reassured by the consistency and felt respected. She complied with her medications, welcomed her new caregivers, and reported in her own words, "I feel safe and in control." The clinical takeaway in this example is that a collaborative, empathetic approach empowered Mrs. Alvarez, reduced her anxiety, and led to a smooth, successful transition. Now we're going to move on to our third tale of transition, and we get to end on a giggle and talk about Mrs. Diaz and her care coordination. I personally was able to be involved with Mrs. Diaz's care, and it was really a joy to be able to watch this care coordination. She is an older adult determined to remain in her home, despite many physical limitations. She had refused all county support services, no visitors, no Meals on Wheels, no assistance. She responded to help with anger, driven by fear that accepting help would lead to forced removal from her home, according to her. Adult protective services were previously involved, which made her even more non-trusting. A home instead care manager made daily visits for a week, not to push anything additional, no additional services, but simply to listen and be understanding. Slowly, that trust began to grow. With compassion and calm communication, the care manager gently reintroduced the idea of support from the county, not as a threat to independence, but as a tool to help preserve her independence in her home. So when asked on one of those visits why she opposed Meals on Wheels, Mrs. Diaz revealed, "The food was horrible. I tried it when my husband was alive." The care manager gently asked, "Mrs. Diaz, would you share how long ago you tried the food? I do hear many great things from the other clients, and even that the chef is pretty good." She paused, kind of thought about it for a minute, and then she started laughing. And she said, "You know what, darn it, you're right. It was 17 years ago. I'll give it a try." The next day, after they shared this giggle together, the care manager and Mrs. Diaz, Meals on Wheels was set up with the county. That giggle, a moment of connection, was the breakthrough for many more positive changes to help Mrs. Diaz with her safety and independence in her home. So now I'd like to transition, if we can, back to Lakeland for some important key takeaways.
Thank you so much, Therese, for sharing those various tales of transition. I think it always helps to kind of put this into context, and love how that last tale, even, it really illustrated the trust that had to be built, and the open-ended questions. I'm sure no one had asked Mrs. Diaz, why she didn't want to try the Meals on Wheels. And so, just asking for more information, getting curious, helped in that situation.
Not giving up.
Yeah.
No, it's okay. Taking the time and not giving up, just like we talked about.
Oh,
so
absolutely. Yeah, that persistence. Yeah. So as we wrap up, the key takeaways from today's webinar really is, supporting older adults through change. It's not always easy, but with the right mindset and tools, hopefully we can help make a difference in their well-being. So a few key things to take away, how we handle change matters. It can lead to empowerment or distress, really depending on our approach. So hopefully we're leaning more towards empowerment with the tools we've provided today. We also just need to slow down and listen. respect their pace and let them feel heard. And I know we're all so busy in our jobs. So many of us are pressed for time. We have to meet with so many individuals or get through our caseload. But if we can take that time to slow down, it really can make the difference. Also, communicating early and clearly can help reduce that confusion and stress. Involving the older adult in the decision really helps to build the trust, honor their dignity, and hopefully get more of their buy-in. Also, framing support as preserving independence and not limiting the independence, that can be a key to success. And then adapt for any emotional or cognitive needs that the person has. That flexibility is so key. And then finally, lead with our empathy, trust building, and inclusion. That can really help support successful transitions. And so, again, I want to thank you for joining us and for the care that you show to the older adults that you work with each and every day. You're all making such an important difference. Even on the days that you are being met with that resistance and it can feel defeating, you are making a really important difference. So as we transition here to questions, Q&A, we have a few minutes left. I did want to leave a few resources on the slide. There's not a ton out there as we were compiling our resource slide, but there is a great course, Health and Behavior Change. So we hyperlinked to that, and I know you can download this slide deck and click directly to that link. Also, on my podcast, Caregiver Chats, I've hit a couple of these topics, overcoming resistance to care and addressing tough conversations. So those could be good resources to go listen to, along with articles by the NIH, Psychology Today, and the American Council on Science and Health. So Victoria, I know we just have a few minutes for questions, but would love to turn it over to you, and we'll get to as many as we can.
Sure. Thank you so much, Therese and Lakeland, for that presentation. I'm just going to jump right in and combine two questions that we have. Can you go into what the difference is between reflective and active listening? And is it appropriate to say, please tell me more about that to encourage deeper responses?
That's a good question. I think, well, first, I think it's always appropriate to say, well, tell me more about that, or that's interesting. Could you explain more? Because I think it acknowledges, like, we're listening. And what you have to say is interesting to me. It's important that I hear and understand and really learn more. Active listening and reflective listening, that's a good question. I feel like I'd have to go back and do a little refresher myself. But I think really active listening could be maybe like your body language showing that you're listening, and reflective listening is kind of another component of listening where you're reflecting on what that person said. So from my perspective, and I don't have the proper definitions in front of me for both, but that's kind of how I would kind of differentiate. Therese, did you have any other thoughts on that question?
No, that's exactly what I'd agree with. I feel like reflective listening is defined more by almost repeating or summarizing what someone has said and reflecting those words back to them to not only demonstrate that you hear them, but it also allows you that opportunity to receive feedback that your interpretation is correct. And when you take that time to reflect, a person hears their words back, and it really, I think, makes them see that you're seeking to understand, and then allows for any of that kind of clarity. Active listening, I think, is, like you said, using body language. So reflective listening and active listening obviously are very similar, but I would define the reflective as that repeating process back and kind of summarizing someone's thoughts.
Well, thank you so much. We also had a question, and this might have to be our last question, but can you speak to how cultural differences may impact or older adults' experiences may impact how they transition or adapt to changes?
Yeah, I would say that's something you definitely have to keep in mind, especially, depending, we talked about so many different types of change. And so our culture, our background, our life experience is going to impact, those various changes. And so I certainly think we need to keep that at the forefront. And when appropriate, get curious, ask, if there are certain, kind of discrepancies maybe between their cultural background and what you're asking them to do, ask questions about that, or say, well, help me understand from your perspective how you see this. I think that it shows that you really value them. Therese, anything else to add on that?
Like that's exactly what I would say is, and I love that. It's about expressing that curiosity and seeking to understand. I think we could make assumptions about how someone may feel culturally, but the best thing we can do is truly to seek to understand how they are experiencing that change, and to really, really listen.
Great. Thank you so much. And Lakeland, thank you for putting that slide up. So if anybody does have a question that we weren't able to get to, you can reach out to Lakeland directly. She has her email up on the screen, and you can download these slides from the materials tab right above where the presentation is, or in your classroom. Unfortunately, we are out of time. But I want to thank you for joining us today for this important conversation on supporting older individuals through difficulties and change. We do hope that this session provided some practical tools and meaningful insights and renewed inspiration for helping older adults navigate life's transitions with dignity and compassion. I want to give a special thank you to our presenters, Dr. Lakeland Eichenberger and Therese Cesar, and the Home Instead Senior Care for their partnership and support in making this session possible. We encourage you to stay connected and to join us for our next webinar, Navigating Ethical Issues in the Care of Older Adults. That's on July 9th. And you can check out all of our upcoming webinars, including the webinars for Home Instead for the rest of the year, because we did have someone ask for that list that we had in the introductory slide deck. You can go to asaging.org/webinars. If you want to check those out. And if you have any questions, please feel free to reach out to us at institute@asaging.org. Thank you again for joining us, and we look forward to seeing you again soon. Have a wonderful day.